Welcome to another edition of our Focus on Facebook. My name is Dr. Hasnain Kermali. I'm the Chief Medical Officer here at St. Mary's Hospital in Waterbury, Connecticut. Each month we like to bring you an insight to some of our clinical departments that we're able to offer here to the community in Waterbury through St. Mary's Hospital, and some of the expert providers that are also available for our patients to be seen with. Today we're excited because we're going to focus on urgent care, which is a little bit different spin, combining both the hospital but also definitely the outpatient market. And I'm really excited to welcome Dr. Kurt Myers, a pediatric emergency medicine physician with 50 years of experience, but who brings a different kind of expertise to our community. So welcome, Dr. Myers.
Thank you.
So longtime member of the St.
Yes.
Mary's family, having served in our emergency room for a number of years.
For 25 years.
25 years. Before we get into the nitty gritty, tell us about your journey into medicine. Certainly different today than it was as you were coming through.
Back in the 1970s, yeah.
Sure.
Yeah.
What led you to emergency medicine?
So that's that's a great question,
Yeah.
because I spent the first 6 years of my practice in federally qualified community health center.
Okay.
In the very difficult sections of Hartford.
Sure.
And the month after I started, I became the only doctor for 10,000 people.
Wow.
Because the internal medicine doctor left.
Mm.
So I became the doctor for the whole area.
Yeah.
And took care of everybody coming in and learned how to take care of adults with sick problems.
Sure.
Didn't do primary care with adults, but I took care of sick adults,
Yeah.
sick kids. I was the only one there for 6 years. And you realize after a while, people would choose the easiest way for healthcare.
Mm.
They always want to choose the easiest and best, but they don't want to wait long times
Sure.
in the ER. So they would come to us. And I recognized that Hartford Hospital at the time was the only place that did that kind of stuff. So we started an after hours center,
Okay.
urgent care, emergency medicine
Yeah.
at Hartford Hospital.
Wow.
And I became part of that.
Okay.
And we built that from 9,000 patients a year to 30,000 patients
Sure,
a year.
yeah.
In the 14 years I spent there.
Gotcha.
And that ER became Connecticut Children's Medical Center.
Right.
And
Wow.
I came here instead. So we kind of did the same thing here.
Yeah.
You know, what led me is the fact that kids need care. And you can see that back in the day, there weren't always board certified ER doctors taking care of kids.
Correct.
They were internal medicine doctors who tried.
Took some time. Yeah.
Yeah, and learned. And now you have board certified ER doctors, but their training isn't quite the same as a pediatric ER person. And there's a comfort level. Am I comfortable seeing a 102 years old? Not completely, but they're not comfortable seeing a 2-month-old either.
Sure.
And they shouldn't be.
Yeah.
So that's why you have the specialty.
Yeah.
That's kind of what drove me to it, is to see that the kids needed care and they didn't want to be waiting in an emergency room with everybody else.
Right.
So separate it out, provide it after hours, especially for the pediatricians in the community, because that's what works. Is
Yeah.
you want to be their backup.
Yeah.
You know, back in the day, they sewed people together. They don't do that anymore.
Right.
So the kind of thing is you want to be able to be there for their sicker patients.
Sure.
And recognize when they're sick.
Yeah.
And now urgent care, same kind of thing, a little less severity of illness.
Sure.
But not always. Depends on who walks through the door.
Yes.
Right?
Indeed.
But it's a great continuity of care for patients once they come to the urgent care.
Yeah. You know, and we've talked about our pediatric emergency room and the focus we have with those providers downstairs
Right.
before. So I'm excited to see that legacy continue. And certainly a 2-month-old is not simply a smaller 20-year-old.
No, they have problems related to that. And you know, you really want your primary care docs to see your kids first.
Yeah.
And then you want them, if there's a problem, they recognize there's a problem, send them to the pediatric ER.
Sure.
We'll see them in urgent care, but we tend not to have as many in pediatrics. You know, we do see things there's some great primary care practices in the area,
Yes,
and
there
they
are.
all are big feeders into the pediatric ER here.
Yeah.
And that's what you want.
Yeah. Well, I'm glad we have it. You know, and so let's talk now a little bit about that urgent care model. So we now have our transition. We've sort of gone through a little bit of a transition. Trinity Health in New England now, again, sort of taking the urgent cares by the horn, so to speak. Why is urgent care such an important access point for patients?
There's a lot of reasons behind that, but
Okay.
it gets down to, and I've also done urgent care for nigh on to 22 years, so it's not like this is something new for me.
Right.
I do know how to do this, and what you want to do is you want to provide the best service in the most efficient way.
Sure.
Right? And it's very efficient for us in urgent care to see people who have coughs, colds, runny noses, lacerations, abrasions, things that we don't want to tie up the ER for. We can get them in and out under an hour.
Sure.
What does the patient most want? They want the best care in the least amount of time.
Yeah.
They
High
also-
quality patient
high quality
care.
patient satisfaction.
Yeah.
You want to see that. You'll get that patient satisfaction. You don't get that if you wait for 12 hours to be seen.
Right.
No matter where you are, whether I don't care.
Yeah.
Nobody wants to sit there.
Yeah.
So we have that capacity to be able to do that in a large number of people. And we can refer those patients now that we're part of EPIC and everything, we can get them back to their primary care
Right.
doctor. And that, to me, that's the key of urgent care, is
Yes.
to get them back to their centers. Because we don't want to be the person managing their hypertension.
Right.
But I do want to help them if they have hypertension.
Certainly.
So that's where a lot of your role is in urgent care. And it's open late till 8 o'clock at night, so we can see those people.
Yeah.
And again, if you're in and out under an hour, that's a good way to handle things.
Sure,
They
sure.
like that. The other thing, obviously, is the cost.
Right.
We are, nowadays, with high deductible insurances, the major insurance companies don't want you sitting in an ER
Correct.
because there's your $6,000 deductible
In one visit.
in one visit.
Yeah.
So we're a less costly way to handle those patients. And short of chest pain, there's very little that we can't do.
Yeah.
And not that we can't do chest pain. We will end up sending you to the hospital for that.
Right.
But, we're a good first stop. But short of that, we'll do almost anything.
And you hit on a couple of points I want to expand on. Number one is the effectiveness of time.
Yes.
Because certainly when you walk into the emergency room, you're now in a dare I say, a competition. I'm trying to reframe triage. But your care is going to get predicated to sort of where your level of severity is. So if somebody rolls through right beside you who's coming in on an ambulance with an emergency, whether it's trauma or whether it's
Right.
a massive stroke, that those resources are going to have to be split up to some degree. And I think we've been doing a fantastic job. Great commendation to our teams at the front desk here.
Yes.
Who have changed the model
Yes.
of how patients get seen, particularly with a lower level of illnesses
Right.
in our emergency room. But certainly there's still that resource intensity
Yes.
question. And whereas in urgent care, you're not
We're
having
built for
to
it.
deal with
We're built
the
for that.
emergent care, right?
No, we're built
Right.
for it.
So the ambulance isn't coming to urgent care.
No, they'll leave.
They'll leave from there.
From there.
Yeah.
But one of the things that most people aren't aware, I spoke to Amber a little while ago about, my staff is all ER trained staff. They're all trained by me,
Right.
and together we have 120 years of experience.
Wow.
So I want to separate our urgent cares away from other people's urgent cares
Yeah.
because all of them do have pediatric experience.
Okay.
So you can be comfortable coming to a Trinity Urgent Care Center.
Yeah.
Everyone there was trained by a pediatric ER doc.
Which is amazing because now you're able to take care of that child with a runny nose.
That's correct.
As opposed to them coming into an environment where they're having to mix with adults.
That's
Even
right.
as much as we try to separate things, there's
Right.
still a little bit of crossover. And yet they're getting that high quality care from a pediatric trained
Yes,
urgent care.
and there's almost nobody who has an urgent care center who has that level of training for
Wow.
pediatrics.
Which is
Nobody.
amazing.
They don't have it.
Which and I think that's a big differentiator. Certainly you can go in, but that 120 years of experience is something that you can't always
No,
get
you
in
can't buy that.
in
No.
today's environment.
No, some of these,
particularly with
and it's one of the reasons why I tell people when their kids are coming to the Trinity Center, I say this is where you need to come.
yeah.
I don't want you to go to other centers because they don't have pediatric trained people there, and you got a little kid. You need to come where where people can deal with that.
Yeah, yeah. So what else should people be coming to urgent care? So we talked about chest pain. Maybe come to the hospital for chest pain. But
you can always come to us. We're going to ship you on,
Right.
unless you're an 18-year-old who has musculoskeletal chest pain, and we can start with that. But a 50-year-old who has chest pain is probably going to end up in the hospital.
correct.
If you're pregnant and you're imminent delivery, I would suggest you go to the hospital.
Yep.
Most major lacerations we're gonna at least stabilize for you.
Okay.
But we can fix almost any laceration.
So cuts and scrapes.
Absolutely.
Come to the urgent care.
Yep. Broken bones we can fix. We've got radiology at both centers.
Great.
So we can do that. We can read them instantaneously.
Yep.
We have orthopedic backup. So if there's a problem and it needs to be dealt with, we can get them to the private ortho or we can get them to the ER. So
Right.
we're a really good triage center for that.
Beautiful. Beautiful. So this is, again, that transitions of care. We're managing patients, high quality, patient-centered care.
Right.
Again, that philosophy that continues to permeate throughout Trinity Health of New England.
Right.
Now, how has that evolved over the past few years? The urgent cares. You've been working with them for an extended period of time.
I've been working
built
with them,
CCMC
yep.
your whole career. How's it evolved in your eyes?
Well, I built the CCMC ER and I came down here because Dr. Jacoby said come down here. So
Yes.
I built the pediatric
Pediatric
ER here. And at the same time he said, can you handle the urgent cares? So then I went to the urgent cares and that change has been a lot of what primary care doesn't do anymore. Okay, primary care has changed over the years.
Sure.
I'm from a generation where even in the ER, the pediatricians would often come to the ER and see their patients in the ER.
Right.
When I was, that was back in the 80s. Now you don't have that.
Correct.
And you have a lot of primary care offices that stop at 4:30.
Right.
So you don't have the acute cares as much in the primary care offices as you used to.
Sure.
And that's just a function of how medicine has gone. And I see that as the biggest difference is that you don't have, if you call your primary care doctor because you're sick, most of the time you're not going to get an appointment the same day.
It's not easy.
It's not easy.
Yeah.
And if you're told it'll be 3 weeks, the patient satisfaction on that's pretty bad. So that's where I see us as a real adjunct to the primary care offices. And that's where people come.
Yeah.
They're sick. They need a note for work for tomorrow. They
Right.
don't need a note in 3 weeks.
Right.
And that's not a knock on the primary care. It's just the way the focus has been now.
Sure.
Toward maintenance of the primary care and getting all the things done that needs to get done for that patient.
Yeah. Well, and we talk about that evolution because those primary care physicians who used to come to the hospital now have this patient panel
Yes.
that is needing their chronic
Absolutely.
management taken care of. Their
Yep.
high blood pressure, their
Right.
high cholesterol, etc. Diabetes continues to be an epidemic across the United States and the
Epic
world.
tells you what you need.
Right. And so they're still managing all of those patients.
correct.
Which means we need to fill up those gaps on
Yes.
patients who still need that urgent care.
Right.
And then the timeline is very interesting too. So our urgent cares are open a little bit later
Yes.
than the regular primary care office.
Yes.
So for after work,
That's
something's
correct.
going on at work, went into work, whatever, slipped, something happened during the day. I still need to finish my day and then move on.
Yeah, absolutely. We do limited occupational health, although we're able to do that. The primary thing for Occ Health here at Trinity is you need to see the people at Trinity's
Sure,
Occ Health.
yeah.
But there are a lot of people who are uncontracted agents who fell at work and they come to us, and
Sure.
we then facilitate that transfer to Occ Health to handle that in the hospital.
Yeah.
So we're a good feeder into that for injuries.
Well, I think, and we talk about that connected care.
Yep.
So now we've got the same instance of Epic
Yep.
at the urgent
Absolutely.
cares as the one that we have at the hospital, as the one that we
Life-changing.
have at the primary care physician. Oh, I imagine.
Life-changing. Well, we had
Good or bad, but
Well-
we're gonna just say life changing.
I will say that as long as I've been doing this, I come from a paper background,
Sure.
right? Where nobody knew anything about what happened.
Yeah.
Because you had a piece of paper in front of
Right.
you and you had to write it out. That has changed.
Yeah.
And now we have this very interconnected chart system
Yeah.
where I can see, hey, you had this done here, you really need to have this done, and now I can help them.
Yeah.
I can help the primary care person complete that cycle.
Yeah.
And we can do lab work at the urgent care centers. We do that all the time. So, there are people who come in and with diabetes, and diabetes is a good example, because patient management of that is good from our primary care people. On the other hand, patients don't like to go to the doctor.
Sure.
And we will be often the person who come take care of that person with their A1C of 16 or 15 and provide the counseling, provide some of that initial medicine, or at least get them to it,
Yeah.
and then get them back to their primary care, and we can do that.
Yeah.
And that's key. Hypertension and diabetes, if we can help them with that, I think your long-term part of that is much better.
And then, so we're managing the chronic diseases, getting them back to the primary care. The more urgent, emergent cases, we're managing those quickly in the urgent cares and then sending them on to the ED.
Yep.
Great connectivity between the two.
Yes.
Excited about some of the new AI stuff that's coming in that's going to make our jobs easier when we see a patient who's got a big chart that's going to sum it up for us, so that when you're seeing them, you're not digging around trying to figure it all out.
That would help. Sometimes with
Brings
Epic
it
it's
out.
too much.
Yeah.
And you look at it and you go like, I'm just dealing with this today.
Yeah, right.
But our goal is to make sure that that person has all of the things that they need for that visit.
Yeah.
In a good amount of time, and patients appreciate the time you spend with them.
100%.
You can spend 10 minutes with a patient and make them feel like they had an hour.
Yeah. Yeah.
And I think that I've trained my staff so that they all kind of know how we work, and your key is, if you do the right thing, people like that.
Right.
And people will respond to that. If you just treat them quickly and send them, that's not a good outcome usually.
Yeah.
And it's all about the contact. I'll give you an example. Follow up from the urgent care. I call or send messages to all those patients who have labs done the previous day. In the morning, they'll get a phone call or a message from me.
Right.
So everybody who has a problem, they'll know about it. That's communication.
That's communication.
Right.
And we miss that opportunity sometimes, because and of course there's opportunities for patients to gather their own information.
It's true. And actually, I had talked to our director about that about 6 months ago, and I said, we really need to make a push for everybody to be on my chart.
Sure.
And I think that if you make that push hospital system-wide, patients have a responsibility for their own labs too.
Correct.
Right? And if you can access your own labs, maybe you can help things a little bit better.
Yeah.
And communication.
It certainly has helped with my relationship with my physician.
Yes.
Because now the conversation, even if it is physician to physician, the conversation is informed.
Yes.
I can see what he's seeing.
Yep.
I know where he's coming from. And that conversation becomes much more smooth.
Yes, I agree.
Especially if I have the labs before I go to see him, because now we're going to have a discussion.
Right.
As opposed to just being told,
Yes.
hey, this is sort of what's going on,
Right.
and having to ask, hey, can I get a copy? It's much more fluid between.
And healthcare is a negotiation between people.
Right.
It's not always do it my way.
Correct.
It's a negotiation.
Yeah.
And sometimes there's many different ways to do things. Not always the same way.
Yeah.
And it's that communication is critical. I think our satisfaction rate goes through the roof when my staff is good with communication, and then we do the follow-up for them. The patients really respond to that.
I love to hear, again, that patient-centered care coming forward again and again and again from the work that we continue to do. So what's challenging? What's the challenge in urgent care, number one? And number two, why do some patients still say, I just want to go to the ED?
It's a tough answer. The patients that go to the ED in general, don't have a great relationship with their primary care doc.
Gotcha.
And their life center is more urgent than just regular kind of stuff. Sometimes it's knowledge that an urgent care center is there.
Yeah.
Right? I mean, if
Our urgent cares are open.
if you don't know they're there,
right.
you don't go.
Right.
Right? Because the ease of coming to the ER and registering, that's easy. Getting seen is hard.
Yeah.
but it's easy to come through
To
the
walk
door.
through the door. Yeah. You've got a big sign standing out there. Yeah.
Right. So I think the biggest thing is knowledge of the centers that they're there. The fact that we can tell them, hey, we'll see you. You can be in and out under an hour and
Right.
you'll have great care. Pushing that forward, and when we can combine that with, hey, this information will all be with your primary care doctor. But I think the challenge is the primary care docs don't have the ability to see these people in general, and they have a problem that's immediate in their mind. And how do you deal with that?
Yeah.
Right? It's immediate in their mind. It's not language based, and it's not based on anything other than I have an immediate problem.
Yeah.
And you and I both know that patients generally will go to the easiest, quickest,
Well, sure.
and sometimes most efficient.
Yeah. Yeah. And even if you call up your primary care and they said, hey, we'll see you this afternoon, you as a patient might say, I think this is more than that.
Exactly. There's always, I tell people when they say see patients, they say their emergency is their emergency.
Right.
It's theirs.
Yeah.
And they may think it's the worst thing in the world.
Sure.
And you don't, but you need to make them feel like
Right.
it is.
Right.
And everybody knows that they can see people here, and the question is, how can we market it to people and say, hey, you can come to us too.
Yeah. And we're a walk-in urgent care.
Right.
So they don't need a call appointment. They
No.
open the door, they walk right in.
No. Appointments in general, we've gone back and forth with that kind of thing, and doesn't really work very well. Because it's rare that you can have a combination walk-in appointment kind of place, because the people who have appointments are expecting to be seen before the other people in this
Sure,
room,
sure.
and you have conflict over that.
Yeah.
So that it tends to be a little bit easier if we can manage. And we can manage 4 patients an hour.
Right.
That's the number.
So they're moving through.
They're moving through 4 patients an hour. That's what we can manage at we can probably manage more at Naugatuck because it's bigger.
Yeah.
But West Main's the standard for me, and that's 4 an hour. And in the ER, when you would see 15 patients an hour, that's tough.
Yeah.
Because there's no way to put 15 patients an hour anywhere.
And it certainly creates a different challenge. But certainly that patient being able to walk through the door, getting seen in a timely manner at a timing of their choosing, but yet not having to compete with everything else that's going on in the emergency room.
Right, absolutely.
And certainly, we want to stress the emergency room remains open,
absolutely.
but so is the urgent care.
Yes,
Open until that time, and,
Yep.
and then that's the opportunity for them to continue.
absolutely.
Yeah. All right. Well, let's start bringing back what we had done. Sorry, I'm just going to turn this down for a second. What we love to do is our previous guests. We've started that this year. They give us a question for you, so they're asking forward. And the question that came from Nara Santana, who was here the last time, was, "What do you bring from your previous experience then you can apply in your current practice?" Almost like a softball question. She knew you were coming. What do you bring from previous experience that you can apply in your current practice?
I have had lots of experience doing all of this.
Yeah.
In managing lots of staff, managing patients, and know that what works for patients, and that's my experience, is it's 50 years of doing this with various organizations.
Yeah.
And building things that have been very successful. And it's all about knowing how to treat people the right way.
And I love to hear that experience is invaluable and certainly not found as readily in today's world.
No, most of us are retired at this point.
Yeah, no, and certainly we still have Peter Jacoby
Yeah.
who's here at our wound center.
Yeah.
We've had a conversation with him as well.
Yeah.
So in that same avenue, would love for you to ask a question for our next guest.
So I would ask what your organization or yourself would bring to the network of the Trinity St. Mary's organization.
Gotcha. So what are they bringing?
What are they bringing
What are they bringing to the network?
to the communication, to the whole program?
Love it, love it. All right, so we're gonna keep that recorded, and we'll bring that back for our next guest. And finally, we're gonna bank on that experience, a nugget from you and your medical knowledge to our viewers in terms of maintaining their health.
Get a lot of lacerations, and the decision,
Lot of cuts.
a lot of cuts,
Lot of cuts.
a lot of cuts. The decision about what to do with that.
Yeah.
And I'd like them to make sure that they don't just rush off to the emergency room right away. That you can make a phone call
Okay.
to your primary care doctor first if
Yeah.
you want. You can come to us, but try not to take care of that yourself, and we'll help you with that.
Yeah. So big cuts.
Big cuts.
Come on in.
Come on in.
Sounds good.
If it's a facial laceration, we still can fix it because all of my guys are trained.
Nice. Love it. Love it. Love it. Well, thank you again,
Okay.
Dr. Myers, and thank you all for joining us. Stay tuned to our next Focus on Facebook, and we look forward to seeing you in the future. Take care.